Hello, my name is Piyanat Priyanon, an interventional cardiologist from Perfect Heart Institute here in Bangkok. With me, I have Dr. Alexandra. Sorry, เอาใหม่นะคะ Hello, my name is Dr. Piyanat Priyanon, an interventional cardiologist from Perfect Heart Hospital here in Bangkok, Thailand. I have Dr. Lansky with me today. Welcome, Dr. Lansky.
Thank you very much. So just by way of introduction, I am from Yale University in the United States, and I'm the Director of Interventional Cardiovascular Research at Yale. How are you?
I'm good. So this is the first time in Bangkok?
It's
Dr.
not the
Lansky?
first time in Bangkok. I spent a month as a medical student on an exchange program in one of your hospitals here in Bangkok, and this was many years ago during my medical school training, and I absolutely loved it.
So how's Bangkok has changed?
Bangkok in the last 20 years has changed enormously. There are many more buildings, high-rises, maybe a little bit more pollution, but beautiful city, and the people, the Thai people are just so hospitable, very, very nice people.
And how about the weather?
Weather I cannot tell. I just landed yesterday, came to the hotel, and so I haven't been out.
So you will have a chance to go out and feel some weather.
Absolutely.
Probably tomorrow
I'm
morning.
planning.
Dr. Lansky, why do women do so poorly with acute MI?
You know, I think this is a critical question. When we look at women specifically across the spectrum of acute coronary syndromes, even going from stable coronary syndromes, the one area that remains problematic for women is STEMI. There are many reasons for that. I would list number one, delays to treatment. There is, I think, at least in the United States, but I understand in many regions of the world, the same problem, and that is that women themselves are not aware of the time factor, how urgent it is to seek medical care. We see in the United States about a 15 to 20-minute delay compared to men in presenting to the emergency room. And from my little bit of research and what I was listening to in the lectures here at Lumen, I think it's the same thing for women in Thailand. That's the first thing. The other thing is that the treatments that are available, whether it be thrombolytic therapy or primary angioplasty, seem to not be as good in women. They certainly benefit women. There are improvements in mortality, but the benefits do not seem to be at the same level or the same degree as what is seen in men. There are some problems that are very specific to women, such as just their demographics when they present with the acute coronary syndromes. They tend to be older. They tend to have many more risk factors, more diabetes, hypertension, etc., putting them at higher risk for mortality and recurrent myocardial infarction. So that's number one. Number two, women are prone to much more bleeding complications. And this is really emerging as a primary factor. So in addition to the fact that they have more risk factors, the fact that they're more prone to bleeding, we have learned through a number of studies that have been done in the last decade that this is a risk factor in and of itself. And through some research that I have been involved with, what we now understand is that it's not being a woman per se that increases the mortality risk. It's more the fact that women have more bleeding, and it's the bleeding that actually increases the mortality. So those are the primary, factors I would say that impact the outcome of women, and actually they tend to have worse outcomes than men.
And what are some of the critical steps in Asia that can improve the management of acute MI in women?
Yeah, I think that the steps that need to be taken are broad-based. They're not necessarily specific to Asia. I think they apply really globally. I think there are some factors in Asia that require a lot more focus. Number one being the education of female patients. I think that is critical. So what we have done in the United States is that there are a number of programs and groups that are dedicated to educating people through mass media, through the television, through cell phones, through websites, etc. I think that's absolutely critical to be able to get out to people so that they understand, the impact. The longer they delay to presentation, I would say from just the numbers that I have heard today in terms of the time delay to presentation, that applies both to men and women. It's not necessarily just specific to women, maybe a little bit longer in female patients, but I think it's global and it needs to be addressed. The other issue, of course, is creating an infrastructure that allows the patient to get into the hospital. So once the patient has identified that they have signs and symptoms of a heart attack, they need to be able to get into the hospital, to your hospital, as quickly as possible, so that the time to emergency room presentation is expedited. The next step, of course, and again something that we have seen in the United States, is that there are delays from the time patients get into the emergency room to treatment, whether it be thrombolytic treatment or primary angioplasty. And we have, again, in the US, we see delays in treatment. And as I understand it, the same thing happens here in Thailand and in Asia. So I think the focus there needs to be education of the healthcare system and really trying to expedite availability of treatment. Whether it means having cath labs that are open 24 hours, there are many, many different things that can be done to improve the time to treatment, and require a lot of infrastructure, require a lot of resources to actually put in place. Doctors that are willing to be available to treat patients even during the night. What are some other things? There's a whole host of other things, including, the proper pharmacology. What drugs do you use for the patients? There's no question that if you're in a rural area where you don't have primary angioplasty available, thrombolytic therapy is the best treatment. But if you do have primary angioplasty, by far, the outcomes are much, much better. And the benefit of primary angioplasty over thrombolytic therapy in female patients outweighs that of the benefit seen in men. So that's another big factor. Another issues is what devices do you use, what medications do you use, what antiplatelet agents do you use, etc. And in many cases, for women, it's really a balance between the benefit of the agents and the drugs and the procedure and the bleeding risk. So we always need to be very, very cautious with women because of the excess bleeding, and understanding that bleeding actually can lead to higher mortality rates. So I think all those things. The number one factor in my mind is really the infrastructure, the system, getting the patient to the hospital in a short period of time. I think by far, if we had to choose one thing, that would be the one.
This is a terrific answer. Thank you so much, Dr. Lansky, for joining us today.
My pleasure. Thank you very much.